2.5-year-old girl dies at Karnataka's KIMS hospital due to lack of medicines. The Karnataka Institute of Medical Sciences KIMS in Hubballi, often regarded as the lifeline for healthcare in North Karnataka, came under intense scrutiny following the tragic death of a 2.5-year-old girl on Monday, April 14. The child, reportedly the daughter of Bashir Ahmed and Nikit from Anandnagar in Old Hubballi, is alleged to have died due to a lack of essential medicines, a claim that has reignited long-standing concerns about systemic negligence at the state-run institution. According to the grieving family, their daughter had been under treatment in the intensive care unit ICU at KIMS for 16 days, suffering from complications related to pediatric inflammatory multisystem syndrome (PIMS). Despite initial signs of improvement, the child's condition suddenly deteriorated on Monday evening. The family claims they were informed of her death around 9 p.m., just hours after being reassured of her recovery. The most serious allegation centers around the hospital's inability to provide critical medication over a span of 4 days. The pharmacy, according to the family, repeatedly cited a no-stock status, leaving them to purchase expensive drugs from outside. Costs they say were unbearable for a low-income household. They also allege that the child may have slipped into a coma due to improper dosing, raising questions about both the quality and consistency of care in the ICU. This is not the first time KIMS has faced such accusations. Previous reports had already painted a picture of chaos and mismanagement at the institution. This latest incident has only deepened public mistrust, with many accusing the hospital of failing its mandate as a lifeline for the region's most vulnerable patients. Additionally, the hospital board had recently increased outpatient registration charges from 10 rupees to Rs and inpatient registration from 30 rupees to 50 rupees, increasing public frustration. Charges for diagnostic services such as X-rays and scanning, as well as official documents like birth and death certificates, also a tenfold rise. Notably, the fee for birth and death certificates had jumped from 5 rupees to Rs 50. Swipe left for next video. KIMS director Dr. S.F. Kamara defended the revised pricing, stating that the hike had been in discussion for over a year and was approved following consultations with the state's medical education minister. We have increased fees by only 510%. Even if patients do not have money, we will continue to provide treatment. This move is to help maintain the quality of care, he said, adding that fees related to below poverty line BPL card holders remained unchanged. Despite these assurances, many in the public remain unconvinced. KIMS is the only option for the poor. How can they afford such prices now, asked a local resident, echoing the growing discontent. Civil society groups have begun calling for a full inquiry into the child's death, demanding accountability from both the hospital administration and the state health department. Latest blogs.